Come in.
Wash hands. Good morning, Mrs. Perry.
Good morning.
How are you?
I'm fine, thank you. How are you?
Doing good. My name is Tori. I'm going to be your nurse this morning.
Nice to meet you, Tori.
Nice to meet you as well. Can you tell me your name and date of birth?
Theresa Ann Smith Perry, 92961.
Thank you. And I see you have an allergy band on. Can you tell me what your allergies are?
Any medication containing sulfur?
Okay. Thank you. Mrs. Perry, can you tell me where you are?
I believe I'm in Pineville Medical Center.
Yes, ma'am. And can you tell me what brought you in?
I recently had a fall, so this is basically a follow-up to the fall.
Okay. You don't have any cast or anything.
No.
So no broken bones?
No broken bones.
Well, that's good.
Yes, it is.
All right, and you don't have any IVs running?
No.
Okay. I'm going to start by checking your eyes.
Okay.
And what I'm checking for is to see if your pupils are equal, round, and if they react to my pen light.
Okay.
I'm going to start by measuring the size of your pupils, which they are 3 millimeters bilaterally. And if you'll look straight ahead for me, Mrs. Perry, I'm going to shine this light in your right eye first, checking to see if your pupils react to it. Okay. And now I'm going to check your left eye. And Mrs. Perry, if you would, follow my pen with your eyes.
Okay. Is it supposed to do that?
Yes, ma'am.
Okay.
That means that your eyes are accommodating to the object that's coming towards your face.
Okay. All right.
Have you had
Interesting.
any problems with your ears or any hearing issues?
No.
Okay, I'm just going to check your ears.
Okay.
All right. And skin looks good, same complexion as the patient. Have you had any unusual shedding of your hair or anything?
No, nothing unusual.
Okay. And if you would, Mrs. Perry, say ah for me. I'm just going to check inside your mouth.
Okay.
All right, nice and moist. Pink in color, that means no dehydration.
Okay, all right.
And another thing I'm going to check for dehydration is your skin turgor. Just going to pinch a little bit of your skin just to make sure your skin's not dry.
My skin what?
Skin turgor. Checking your elasticity.
Oh, okay.
Yes, ma'am. All right. Skin turgor is normal. And I'm going to check your neck, just checking for any swelling. Have you had any swelling or anything with your neck, Mrs. Perry?
No.
Okay.
Not at all.
And have you had any cough or anything lately?
No.
Any shortness of breath?
No.
Okay.
Been doing good.
And I see that you're on room air, so that's a good sign.
That's a good sign. It is?
Yes, ma'am.
Okay.
That means you're breathing pretty good.
All right, wonderful. I like that. Okay, we off to a great start, Tori.
We are. Mrs. Perry, I'm
Yes.
going to listen to your apical pulse
Okay.
at the apex of your heart. And in the clinical setting, I would listen at the left mid-clavicular line, 5th intercostal space. pulse was 77 beats per minute, regular rhythm, and S1, S2 heard. Mrs. Perry, if you don't mind, I'm going to have you sit up for me.
Okay.
Lean forward. And I'm going to push these pillows just so they give you a little support so you can lean back if you need to.
Okay.
All right. I'm going to listen to 6 spots on your chest, and I'm going to be listening to your lung sounds.
Okay.
And when I move my stethoscope, if you'll take a deep breath in through your nose and exhale through your mouth for me.
Okay.
All right. Thank you, Mrs. Perry. Lung sounds are clear bilaterally. And Mrs. Perry, I'm just going to check your pulse.
Okay.
Mrs. Perry, your pulse was 80 beats per minute, regular rhythm, normal quality. Your
Great.
respirations were 20 breaths per minute, and they were regular quality.
And you were able to do both at the same time.
Yes,
You
ma'am.
go.
Gotta be
Okay.
talented here.
Got to be talented.
I'm just gonna check your bowel sound.
Okay.
And for the purpose of this video, I'll be listening in one quadrant for 1 minute, but in clinical setting, I would listen in all 4 quadrants for 1 minute each. Vital sounds are active in all 4 quadrants. And while you're still sitting up, Mrs. Perry, I'm going to listen to the 2 places on each side. I'm going to listen to your lung sounds over on those 2 places. And each time you feel my stethoscope move, if you'll take a deep breath in through your nose and out through your mouth.
Okay.
Lung sounds heard bilaterally. And I'm just gonna lightly touch on your abdomen, and you just tell me if you feel anything that hurts, any type of pain, okay?
Okay.
Any pain?
No pain.
All right.
You sure do smell nice, Tori.
Well, thank you.
Yeah.
I'm gonna check your pulses. All right, I'm gonna check your brachial pulses. Pulses are normal bilaterally. And Mrs. Perry, if you could grab my fingers and squeeze as tight as you can. All right. Grip strength is strong bilaterally. And if you will place your arms out in front of you. Okay. Arms look symmetrical. If you'll turn them over, palm up. Pull your arms in towards you. Rotate your shoulders for me. All right. Range of motion looks good. And if you'll extend your arms out back in front of you, palm up. And I'm just going to check your capillary refill. Cap refill is normal. That means good blood flow to those fingers.
Very good. You didn't tell me I was going to have to do an aerobics this morning. Thank you.
We like to get you a little workout.
Okay. All right. Just a little.
Mrs. Perry, I'm going to get you to lean forward for me, and I'm going to listen to 8 places on your back.
Okay.
I'm going to listen to your lung sounds from there.
Okay.
And same procedure. Every time you feel my stethoscope move, if you'll take a deep breath in through your nose and out through your mouth.
Okay. Will do.
Thank you. Lung sounds heard and clear bilaterally.
Okay.
So your lungs sound really good.
Wonderful.
Yes, ma'am. All right. Fix this pillow, and I'll let you lean back.
All right.
Just relax.
Mm-hmm.
And Mrs. Perry, I'm just going to check your pulses behind your knees.
Okay.
Just going to look at your skin. All right. Have you had any rashes or anything lately?
No.
Okay.
Mm-mm.
I didn't see any, but I just
No.
wanted to ask.
No.
Your legs look really smooth.
Well, thank you, honey.
Wish I could keep my legs this smooth.
Not bad for an old lady.
Not bad at all.
Well, thank you, ma'am.
No edema noted. No swelling. That's good.
That's good. That's good. That's good.
I'm going to check your pedal pulses. And I heard from the night shift nurse that you're pretty ticklish. So I'll be gentle.
Please and thank you.
pulses are normal bilaterally.
Okay.
I'm going to check your capillary refill in your toes.
Okay.
Cap refill is normal bilaterally. All right. Can you feel me pushing on your toes?
I do.
Does it feel the same on both feet?
It does.
Okay. This might tickle. Does that feel the same on
It
both
felt the
feet?
same, yes.
Okay. Miss Perry, if you'll take the bottoms of your feet and push against my hands as hard as you can,
Mm-hmm.
and the same with this way. All right. Leg strength is pretty good.
Okay.
Foot strength looks really good.
Okay.
Mrs. Perry, will you take your right leg, lift it up for me, bring it back towards you, stretch it back out, and rotate your ankle for me. Any pain?
No.
All right, we're going to do the same thing with your left leg.
Okay.
Lift
Oh.
up,
Lift up,
back,
bring back,
stretch out, rotate that ankle.
rotate. Okay. Aerobics again.
Aerobics again.
Okay.
Any pain?
No, just a little discomfort. You know, I did fall.
Yes, ma'am.
Yeah.
Where are you feeling the discomfort?
Just a little bit in my leg, you know, side.
Okay. What would you rate your pain on a scale of 0 to 10 right now?
About a 5.
Okay. Have you had any pain medicine lately?
No, I haven't. Not since the early past this morning.
Okay. Well, I'll go check your chart and see. Well, I'll check your chart and see when the next time you can have something for pain.
Okay.
And I'm going to check your blood pressure last.
You got to.
I have to.
Okay.
The night shift nurse told me that it's your least favorite thing
It's my
to do.
least favorite thing to do.
That's why I saved it for last.
Well, thank you. That means you're going to do that leg thing.
That means I'm going to do the leg thing.
Oh, okay.
But at least I won't have to do it for a little while now.
Okay. Save the worst for last.
Save the worst for last. That way you still like me all the way to the end.
Oh. Oh.
There's a method to all
There
of
is
that.
a method to your madness.
I'm going to check your systolic approximation
Okay.
by feeling your pulse behind your leg. And I'm just going to see after I get your systolic approximation, that'll tell me kind of around where I'm looking for when I take the blood pressure.
Okay. Oh, I don't like this thing.
I know you don't.
Oh. Mm.
And I have your systolic approximation at 152.
Okay.
All right. I'm going to let your leg rest for a second, and then we'll check your blood pressure.
Okay.
So have you been enjoying your stay so far?
I have.
Okay.
No complaints.
Good staff.
Good staff.
We have good staff.
Yes.
I like to tell everybody you get treated like a star when you're here.
It shows because they remember to tell you certain things.
Yes,
That
ma'am.
we couldn't do the blood pressure on my arm. I wish we could, but I'm grateful that they made note and that you remembered. That's good teamwork.
Good things to pass along to keep our patients comfortable and happy.
This is true.
Yes, ma'am.
This is true.
All right.
Not
We'll
really,
go ahead
but
and get this worst thing over with.
Let's get it over with. Mm.
Miss Perry, I got your blood pressure at 158 over 90.
Okay.
Does that sound like a normal range for you?
Normally,
Okay.
yes.
Do you normally run high?
I do. I actually take medication for high blood.
Okay.
Yes.
I remember the night shift nurse telling me that you have some blood pressure medicine that we give you,
Yes.
but I just wanted to make sure
Mm-hmm.
that was a normal range for you. I'm going to make sure that I chart this. I'm going to sit my blood pressure cuff down really quick. But before I leave, Mrs. Perry, do you need to use the restroom?
Yes, please.
All right. We want to make sure that we assist you to the restroom since you just had that fall. We don't want you to have another one.
No, I don't want another one either.
I know you don't. You're moving pretty good.
Yes, mobility.
Do you use any devices when you're at home?
No.
Okay.
Not as of yet.
I'll make sure I document that you use the restroom.
Please do, because they'll be trying to get me up again.
Yes, ma'am. We count on those intakes and outputs.
Okay. Keeps me from swelling, I guess.
Yes, ma'am.
Okay.
Keeps you from swelling, keeps you from infections, from backup of urine. So yes,
Okay.
we love outputs.
So that's a good thing to know.
Yes, ma'am, it is. Mrs. Perry, do you need anything else before I leave?
No, thank you. I guess I'm okay.
Okay. Well, I will check on that pain medication for you, and as soon as you can have it, I'll come back in and make sure that we get it to you, and
Okay.
we'll assess you and everything, assess your pain level. And before I leave, I'm going to give you your call bell.
Yes. Okay.
So if you need anything, you just hit this big red button at the top and let
Okay.
us know what you need, and we'll come in and help you out.
All right now.
And your TV button is right down here at the bottom.
Thank you.
I'm going to go check on a few other people, and I'll be back by to check on you, okay?
Okay. Thank
All
you.
right.
It was very nice meeting you, Tori.
It was nice meeting you as well, Mrs. Perry.
Thank you.